Okay, we're going to talk about a condition in the elbow that we see pretty frequently. It's golfer's elbow or tennis elbow. Okay, golfer's elbow on the inside of the elbow, tennis elbow on the outside, and they're basically the same. It just depends on what location, right? The medical term is medial epicondylitis, and then for tennis elbow, lateral epicondylitis. And the way people injure it, the signs and the symptoms, how we treat it, very, very similar. It just depends on which one. Okay, so let's talk about the anatomy. Okay, I'm going to start on the outside of the elbow, so tennis elbow, lateral epicondylitis. So your humerus bone, right? That humerus bone, there's a little portion of it called the epicondyle. It's right at the very end. And all of the tissues or the tendons actually attach on the epicondyle. That's why it's called lateral epicondylitis. And you can't really see it that great on this model, but a lot of these tendons come down, they attach at the wrist and the fingers, and they extend the wrist and they extend the fingers. All of those tendons come and they form what's called the common extensor tendon, and it forms right on the outside the elbow. It's the same thing on the inside. All of those common flexor tendons then come down and they actually attach on the inside of the wrist and the fingers, so they flex the wrist and they flex the fingers. Okay, so let's talk about how do people develop this condition. So think of how it's named, golf, tennis. When people are playing golf repetitively or tennis repetitively, they develop this. That's why they call it this. And so it's kind of it's like an overuse repetitive injury where they put strain on that tissue. So sports can do it, right? Again, I'm not talking about like playing tennis once a month or golf once a month. It's like you're going out and playing 18 holes of golf 3, 4, 5 times a week, right? And you just put extra strain on that tissue. I see it a lot also in like a construction worker or like a factory line worker where they're doing something repetitive. Think of like tightening a wrench or using a hammer. They just are doing this all day, every day repetitively. And so they're putting strain on that tissue. Occasionally, sometimes people they'll get like a direct blow to the tissue. That can cause it. I actually see more often than not when people are weightlifting. So they use either too much weight or they're using the wrong form or doing too many reps and they just put strain on that tissue. Those are common ways people can develop this. Okay, so what are the signs and symptoms? How do we know whether you're having this or not? So you're gonna have a lot of pain and tenderness in that area. If you have tennis elbow, you're gonna have a lot of pain and tenderness on that lateral or that outside of the elbow, golfer's elbow on the inside. You're going to have pain when you do the motions that those tendons or tissues create. So for tennis elbow or lateral epicondylitis, the wrist extending and the fingers extending put strain on that tissue. So if I resist that motion, and even on the fingers, that's going to cause pain in that area. And then same, if I do wrist flexion or finger flexion, it's going to cause pain on the inside of the elbow. That tissue also participates in what's called pronation and supination. So that is, think of like twisting a doorknob or maybe untightening a lid. When you do that motion, it's really, really, really painful to that area. And then you're going to have a whole lot of weakness. Obviously, that tissue has been strained or you have tendinitis, so you'll have a lot of weakness in that area as well. Okay, and so now how do we treat it? So the first thing, we have to modify whatever activity it is that you were doing to create it in the first place, right? Whether it's golf, tennis, or anything else, how do we limit the strain that we put on that tissue? We also are going to try to protect it, ice it, rest it, try to modify that activity. I use this little tool here, it says called Aspen, and essentially we get in there, we kind of dig into the tissue. When you have tendinitis or a strain, little adhesions form, and so we get in there, we try to break that up. We use various different tools that will help kind of stimulate the blood flow to help that tissue heal. We're going to stretch it, we're going to strengthen it. I do a lot of taping on people, and so we'll tape or kind of brace that area. But this is a condition, again, we see it a lot, but it's totally treatable. No one needs to go and do a surgery for this type of condition. Physical therapy is going to be enough, and we can help you kind of restore that function and reduce your pain so we can get you back to golf, tennis, whatever it might be, and help you get back to that prior level of function.